But plenty of people have suffered as a result of their decision to follow the government advice and take this new medical intervention. Some have tragically lost their lives, and as was noted last month at the COVID inquiry by Anna Morris KC, victims and their families have been marginalised and face stigma and abuse for sharing their symptoms and have been branded anti-vax for sharing very real and medically proven vaccine injuries. This is really quite unacceptable. It is way past time that the government does the right thing and follows the recommendations of my honourable friend from Christchurch. It has been shocking to hear how slowly the vaccine damage payment scheme has been operating. Applicants having to wait months. We heard too from the Solicitor Peter Todd at a recent hearing of our APPG on pandemic response and recovery. He described how 139 applications had been waiting, or applicants had been waiting for more than 18 months for a decision on their case. This is excessively long, especially when people are injured and potentially unable to work. We were also told that 162 claims were found to have had disablement caused by vaccine, but it was judged that they were just not disabled enough to merit a financial reward. And in many of those cases, the decision was reached without a doctor meeting or even speaking with the applicant to help with the assessment. And in the rare cases that there have been awarded money, well, that payment hasn't changed, as my honourable friend for Christchurch said, since 2007. So its value has been eroded by inflation, and it simply just isn't good enough. And so, in conclusion, I'll make a plea for transparency and integrity. It's time to be honest with the public about the safety of these vaccines, and we must start by giving them access to information and data without further delay. And we must also, as an urgent priority, look after those who have been damaged or those who have tragically lost loved ones. We may then begin to restore faith that has undoubtedly been lost in the authorities responsible for protecting and promoting public health. There are many unanswered questions, and the repetition from ministers of those three words, safe and effective, for all the reasons I have just given, is simply not good enough an answer, and I'm delighted to be supporting my honourable friend from Christchurch bill today.
Our final panelist is Mr. Steve Kirsch, who also joined us last year. He's a former Silicon Valley high-tech executive. When the pandemic started, he created the COVID-19 Early Treatment Fund. Thank you for doing that. To fund research is working on repurposed drugs. Mr. Kirsch has also testified before the U.S. Senate and presented, as I mentioned here last year. Welcome back to Pennsylvania, sir. Over to you.
Thank you, Senator. We're, over half an hour over, so I'll just be brief. I had a lot more to say, but in the interest of time, I'll cut to the chase. I'm going to talk about the elephant in the room. This is the biggest thing that we should be discussing that nobody has talked about, which is that all these vaccines are causing harm to our kids. It's not just the COVID vaccines. It's every single one of them. There has never, ever been a study comparing the fully vaccinated kids who follow the CDC schedule versus kids who have not been vaccinated at all, who did not get a vitamin K shot, which is not a vitamin, and whose mother did not get vaccinated. If you compare the results of kids whose mom didn't get vaccinated, no K shot, and no vaccines, and if you compare the outcomes of those kids versus kids who got the CDC schedule, there is a dramatic difference. It is an unbelievable difference. It is a difference that nobody wants to talk about. There are no studies, zero, that show the opposite.
Let me be unequivocal from this dispatch box that COVID vaccines are safe.